Welcome to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor, and I'm your host, Alicia Taylor. Hi, Doc!
Hi, Alicia.
Hello, listeners. Today, we have another physiatrist in the building. Well, not in the physical building, but still in the building. And I'm excited to have with us Dr. Earle Smith. And Dr. Earle Smith is a physiatrist at the James J. Peters Bronx VA Medical Center in Bronx, New York. He's also volunteer faculty at Mount Sinai in
Manhattan in New York.
That's right, Doc. That's right. So he comes to us thanks to Dr. Paula Dawson, who did a rotation during her training at Mount Sinai School of Medicine, where Dr. Smith was a resident physician. Hello, Doc.
Thank you for having me.
Dr. Smith, long time.
Dr. Dawson.
Awesome. So today we talk about regenerative medicine. And our specialist, Dr. Smith, is going to tell us a little bit about regenerative medicine.
Well, thank you very much for this opportunity to talk to you about this new old field of medicine. It's been around for decades, and some people would argue longer, of regenerative medicine is ways, different methods to stimulate the body to use its own healing processes to restore, rejuvenate, regrow tissues which have been damaged through trauma or disease or the passage of time. Mm-hmm. And it's a new field of medicine because back only a few years ago when Paula and I were in medical school, we were taught that stem cells, which are the universal mother cell for all types of tissue in the body, we were taught that stem cells, once you were born, were over by age 2. And since then, in the last few years, it makes a big difference. I mean, stem cells are over. But now we know that stem cells persist into adulthood. Yes, younger stem cells are better than an older person's stem cells, but they are still present in everybody. And that's just a fancy way of saying that what we were taught about certain types of tissue, once it's gone, is not necessarily true. We know that you can grow new brain cells, which is against conventional teaching. We know that you can grow new kidney cells, and for Paula and I, things like new connective tissue, like cartilage and ligaments, can be regrown. Common sense, I always had difficulty in medical school accepting, but I tried to memorize it for the test, that cartilage, once it's gone, it's gone. They would emphasize that again and again. Nephrons, which is the kidney cell, once they're gone, they're gone. Cardiac cells, once they're gone, they're gone. I saw a 75-year-old man get up out of bed, and brushing his teeth was hard work for him. His heart was so bad. But after a year, he could walk 100 yards. It took him 10 minutes, but he could walk. And the same, 100 yards to 10 minutes. The same thing with cartilage. If you look at, imagine this is your knee. Sorry, I don't have a better model, but imagine this is your knee. It's a hinge, and there's a little spongy layer of cartilage in there. Well, it just doesn't make sense that same layer of cartilage, from a common sense point of view, would last you 80, right? 10 being 90 years. It doesn't make good sense. So, in fact, there are cells inside the knee growing cartilage, nourishing the old cells, and you can regenerate cartilage. And I started studying regenerative medicine in 2019, and that was the same year that some scientists at University of California, I forget which campus, they regrew mouse cartilage in a lab mouse. So it's kind of nice to have that scientific validation that mammals can regrow cartilage. Another reason that conventional thinking, and we are standing on the shoulders of greats, it's true, but a lot of our knowledge is inherited from the generation before us, which got it from the generation before them, etc. And some of the things that were laid down in the 1700s and 1800s were wrong. One of them being that nerve tissue, once it's damaged, is gone forever. That's wrong. So if you have diabetes or chemotherapy, and suddenly your feet are on fire, you cannot feel the floor, you were told. And when I was in training, and when Paula and I were in training, oh, it's too bad. Your nerves are damaged, and that is forever. That's a pity. So now we know that the nerves are there and sometimes can be restored. So the treatments I'm going to talk about today, I'm going to talk about the very beginning one that I learned, and then maybe on another day we'll talk about some of the more exotic things. And there is a Jamaica connection there, but I'm going to save it for another day. The primary one I'm going to talk to you about is subcutaneous, which means under the skin. Subcutaneous means under the skin. Injections of dextrose, dilute dextrose or sugar water. And it sounds like, what's this man selling? Sugar water to calm down inflammation along the course of a nerve, along the course of a limb, and restore function in that limb. The science is most advanced for knees. And I'll send you the link for my YouTube video on how to do a series of subcutaneous injections around the knee and help the patient to heal old scar tissue and regrow new connective tissue and improve their physical function while decreasing their pain at a much greater reduction in cost, much lower cost than any other type of injection, and certainly much lower cost than surgery.
So, Dr. Smith, this is actually news to Alicia's ear because she doesn't like arthritis.
I hate it.
So, telling her that you can do something to help the cartilage to regenerate is...
it's just fantastic.
It's good news.
Yes, it is. Because, I mean, as you said, they tell us that, there's just no hope. And then you stay there with pain all the days of your life. And that's just the worst thing.
Absolutely. And it's true at all ranks of society. There's professional athletes who depend on their body's physical function who are told the same thing. And Paula and I were on spinal cord injury together. We were studying spinal cord injury together when there was a research project injecting stem cells into human beings' spines to see if we could encourage neurons to regrow because they have so much inflammation in scar tissue. And then you have to remember, go back to your Greek, arthritis. Is arthrosis joint, and itis means inflammation. You can have sinusitis, you can have gingivitis, you can have belly, you can have appendicitis.
Wow.
And now in your knee, you have arthritis or another joint, which is fire. Itis means it's on fire or inflammation. And so we're talking about, inflammation is a good thing. You got a trauma or a wound or an infection. You want to send in some your body's forces to burn out the badness, and then some sort of measured process, the burning or inflammation goes down. Inflammation is a good thing to destroy bacteria and viruses. Yeah. But it can spin out of control and cause damage to you. It becomes too much, and then it blocks healing eventually. And that's what's happening in nerves and joints. The chronic inflammation from injury is preventing the body's healing processes from moving forward. So you can't see your knee from here, but I imagine that you have a little bit of water on the knee. If you go down to the little indentations, the divots underneath your knee, you press on one, the other one will bulge out with water. And that's because the knee is in a bag of connective tissue. I call it the transmission fluid for the knee. And trauma that's happening at the front by your kneecap is actually bulging out the back where it's only soft tissue and you've got blood vessels. So what we do in clinic is we ask the patient where it hurts, and we kind of move their knees around to see if we can feel and hear any grinding, which should not be present, or any clicking. And then we choose injection sites based on that. And specifically, not just the area of injury, but we treat the nerves which are flowing to and from that area. So common injury would be the meniscus on the middle side of the knee is common. So we feel that, see if it's hot, and see if it's clicking. And if the patient tells us, it locks up sometimes. And then we go up the middle of the thigh, following the path of what's called the obturator nerve, following the path of the nerve, which is controlling those muscles and carrying the pain signal from the joint on that part of the knee. And we treat the course of the nerve as well as the injured site, because the nerve is inflamed also. And it can be, we palpate the course of the nerve, we've studied the anatomy, we know where to look for where the nerve is injured, and we press there and see if it's painful. And if it is, we treat that nerve. And then we go to the other side of the knee. We go to the back of the knee. And then after we've treated all the stuff on the outside of the knee, the patients will say, oh, that's good. The bottom of the kneecap feels better. The middle of the knee feels better. But when I stand up deep, deep, deep inside, I can't tell you where it is. Then I have pain there also. This happened to me twice in the year before lockdown. And I said, okay. And we went to books and said, okay, sounds like the ACL, PCL complex, which is the tendons inside the knee that are famous for being difficult to heal.
Cruciate ligaments.
The cruciate ligament, the ACL, PCL complex. And so I went to the table and looked up what innervates those ligaments. And it's the tibial nerve. So where's the tibial nerve? It runs down the back of the calf along the Achilles tendon. And we palpated and found the painful points there and injected them with sugar water, with the dextrose, dilute dextrose, and healed the inflammation in the nerve there. And then I went to the sciatic nerve, which gives rise to the tibial nerve, and I found a couple more points. And all of these points are in Moore's textbook and Moore's Atlas of Anatomy. They're in Netter's Atlas of Anatomy, but we are not taught these points because there's just too many. There's too much to learn. And the clinical significance of these compression injuries in the nerves was not understood. But if you go back, you can find these things in the anatomy textbook from the 1840s. So, and they're in the pictures in Moore's and Netter's Atlases of Anatomy, but they're not labeled. So we found that, and I treated the sciatic nerve and the tibial nerve, and I had him stand up, and he's doing a half squat for me, pain-free, immediately.
Right away. Wow.
Right away, in minutes. And the other thing that's very gratifying is you can see fluid or water or edema or swelling, water on the knee, around the knee, go, and it compresses right down, and you can start to see the contour of the kneecap, for example. This patient has had surgery already. We also treat any inflammation inside the scar that could be causing problems. And then the patients can see for themselves when the scar fades away, that gives them confidence that inside healing is occurring.
Yeah.
And we could go through the whole molecular biology stuff, which I sort of my eyes glaze over when I get too deep. The healing is occurring. The connective tissue is healing. Okay.
Wow.
Another day I'll teach you the cytokines and interleukins, but not today. And so there's a knee that can be done like that. That's the most established. Another point that is established, and it was published in the Proceedings of the Mayo Clinic in Rochester, Minnesota, and is now if you go to the textbook of internal medicine, which is the Bible of medicine, the chapter on neuropathy or nerve disease, neuros is the nerve and pathos is the disease or suffering. The suffering of the nerves chapter, neuropathy, has a supplement on how to use this technique to treat carpal tunnel syndrome. And that's where the first three fingers are weak and painful sometimes. And it's mostly due to a compression of the nerve that flows to these fingers as it goes through the wrist. Conventional thing we do would be to have a surgery here or maybe inject a steroid here and relieve the inflammation right there where the nerve is most compressed. What they have done in this Proceedings of the Mayo Clinic is they looked at the course of the nerve all the way through the arm, through the armpit and up to the neck. And then look, where could it be compressed? And they found points here and here, above and below the ligamentous struthers, and here, above and below the pronator teres, just 0.5 milliliter of 5% dextrose, 1, 2, 3, 4 at each of these sites. And the patient is like this, and they go, oh, and they're like this. Just to see an 85-year-old man, I can feel my fingers for the first time.
That's amazing.
It gives you goosebumps, right? I've got goosebumps right now.
That's incredible. But yeah, so okay. No, and without surgery, can't believe it. I'm so excited. I'm very excited to hear all of this. But you know, we actually have to take a quick break. I'm so sorry, but when we get back, please need you to continue. Stay with us.
Yes, ma'am.
So we're back with Rehab now. If you're just joining us, we have our special guest, Dr. Earle Smith. He is a physiatrist, and we're talking about regenerative medicine.
Yes.
Before the break, we were talking about dextrose prolotherapy. Yeah, man, we get that right. Right? But what I want to know why don't we use these techniques now? Why it feel as if it's falling into disuse, you know?
Well, regenerative medicine was historically rejected as impossible, number one.
Okay.
Once these tissues were damaged, they couldn't be fixed. You just have to cut it out or replace it. And there's in terms of the established practices, corticosteroid injections do work well at relieving pain, even though we know a year later the people who got nothing are better off than the ones who got a steroid injection, perhaps. And also the big drug manufacturers and device manufacturers in the United States are very powerful politically. And they drive a lot of the policy decisions in Washington, which the United States leads the world. And the rest of the world has to follow Washington. And that's why, unfortunately, most of the techniques in regenerative medicine that actually work are done overseas. They're done in countries of Eastern Europe. They're done in the Middle East. And that's where we go to get a lot of the information on how to do these things, especially because so there's political forces in Washington and also in the United States. If you depart from what most of the doctors are doing, that anything goes wrong, you have set yourself up for a lawsuit in the United States, because this country has frivolous lawsuits and even serious lawsuits are more serious than in other countries. But there's also the teaching historically was this could not be reversed. If that doctor says he's actually reversing these impossible conditions, he's lying to you. And that is somewhat established when I tell people that I'm reversing inflammation to treat a lot of different diseases. They don't believe me. I'll just tell you, and you can ask me questions for clarity if you want. Inflammation, an exuberant response of the body to any insult, whether it's trauma or a disease or infection rather, is the cause of every illness. Wow. Whether it's cancer or dementia or diabetes, you can point to every single illness in the body and you can find inflammation at the root cause.
Wow. So tell me something, could these replace the usual treatment?
That's a very good question. I believe that just treating inflammation alone to help the body do its own healing processes is not enough. You are not going to set a broken bone with only calming down the inflammation, the heat, and the pain and the swelling. You can control the heat and the pain and the swelling, and then the surgeon can come in and put the broken bone back together. You can help the patient be pain-free. The same thing with gum disease. I can put techniques onto my face to heal pain where I have a bad tooth, but I still need an oral surgeon to take out the bad tissue and put a pin in. Right. So it's just an adjunct. And then another reason why this was not more established so far is because a lot of the newer techniques are better. Until the 1930s, the average life expectancy in the United States was 35, 40 years. And that's because a simple case of pneumonia could carry off and kill a 25-year-old man. And now pneumonia is trivial. You're 80 years old, you go to your family doctor, he says, take this prescription of Augmentin or penicillins or whatever it is for 10 days and you're fine. But until antibiotics came along, pneumonia was a lethal illness. Now it's a casual illness. And these things are better. Now, if you have pneumonia, scar tissue in your lungs and you're coughing, maybe decreasing inflammation will help you heal, help your bronchitis. If you've had a broken bone and the bone is now set, it's still going to be painful for a long time. How long? Ask me in 20 years and I will know how long your broken bone is going to hurt you. I won't know until 25 years have passed, okay? But we can control the pain and speed the healing along using various techniques. And I'm so excited because the dextrose injections led me as a scholar. I'm not a researcher, I'm a reader. As a scholar to learn a whole bunch of more things that you would not believe can heal inflammation. But I will tell you that menthol, like you find in Vicks Vapo Rub, or capsaicin, like is in a jalapeno chili pepper, or when you stubbed your toe and your mommy said, rub it.
Yeah.
She was correct. And the Nobel Prize Committee awarded the 2021 Nobel Prize in Medicine to the scientists, doctors who discovered the receptors in the nervous system for menthol, capsaicin, and for pressure. Nobel Prize winning medicine for things that our mothers have been teaching us for over a century.
For years. Yeah.
Yes. Amazing.
Right. Now, tell me why do corticosteroid injections continue to be so popular?
This is a very, very touchy subject.
I use a lot of corticosteroid. We all do.
Yeah.
Also, one patient come in and said to me, I don't do steroid injections. I said to him, he says, my wife is on hospice and I need to be able to care for her. Fix my knee pain.
Mm-hmm.
I gave him a corticosteroid injection.
It works.
The Olympic athletes who need to get up on that pole vault and do a tumble onto a broken ankle, they'll get a corticosteroid injection for short-term gain. But overall...
But just to stick a pin there, Earle, they just in 2021, January, the World Anti-Doping, they've actually changed the steroid regulation. So before you could do steroid out of competition, they've now changed that. So you can still do it, but you have a longer washout period. So you have to do it, depending on the type of steroids, you have to do it a few months or weeks ahead so it's washed out of the system. So you can't do steroid in competition, you'll be sanctioned. Right. So
to mask an injury. That's good. It's protecting the athlete. It's a good thing.
Correct. So
your sports medicine, so you're more ahead of me.
Right.
Well, the reason I don't like corticosteroids is because if you're diabetic, they will bump your blood sugars. They will soften your connective tissue everywhere in your body, not just the joint concerned. Why do they continue to be so popular is because they are the accepted mode of practice. Mm-hmm. And there are a few people for whom nothing else will work. They don't. I have injected a few patients with corticosteroid injections in order to loosen a frozen joint. You want the connective tissue softened up. So frozen shoulder is the most common in a senior citizen. Maybe they broke their arm and they were in a sling for a while, and now the shoulder can't move. They've lost range of motion. I had another patient who was a nurse who grabbed a falling patient, tore her rotator cuff, and she could not raise her arm. But she was adamant that she did not want corticosteroid injections. And I was like, I was in a really hard place. She could not move her arm high enough because the connective tissue in her underarm was so constrained that she had to get her sister's help to get dressed in the morning. But we continued. She continued therapy, and we continued with subcutaneous dextrose injections, and now she has normal range of motion. And the orthopedic surgeon wrote in her chart, she received a series of injections from Dr. Smith that healed her rotator cuff. But it took a year. It took a long, long time. And sometimes we don't have time to waste, especially for a senior citizen with frozen shoulder. I had another gentleman with a frozen knee. And he had been in bed bound for some other reason for so long that his tendons were all contracted around his knee. So I loosened him up that way, got him better range of motion, did not have to sedate him and break through the restrictions in his connective tissue. We just loosened him up with steroids, and then we started the dextrose prolotherapy. Mm-hmm. He is my miracle patient. Wow. Because with subcutaneous injections, he was loud and blustery and hard of hearing. I didn't know that he had tinnitus. I didn't know that he had ringing in his ear. He was very dramatic and yelling at everybody, and not in an unpleasant way, but just in your face. Mm-hmm. And it took 8 months, a long time, of subcutaneous injections. And then he disappeared for a couple of months. And he came back, and his gray hair had turned black.
Okay.
What? I know a lot of people want to hear more about that.
Okay.
Guys, I've treated hundreds of people over the last few years, and 3 of them had such horrific pain, horrible, horrible pain that we can't imagine. And they just they just kept walking. They just kept moving. You know, some people were taken to the sofa and died, and these people just kept moving. But when you have pain, imagine you stub your toe. Your heart rate goes up. Your blood pressure goes up. You start to sweat. And the injury was down in your toe. So imagine that as nonstop knee pain that every step you take, when you turn over in bed, you wake up with pain. Everything. You're scared when strangers come close to you. If that shopping cart comes close to you, you're terrified. imagine that level of pain. It's making your heart race. It is keeping adrenaline flowing all the time. Your hands are cold and clammy because of adrenaline, and your hair follicles, your hair is falling out and turning gray. Your body is in a state of stress, constant fight or flight mechanism. So I got 3 patients out of hundreds. So this is not a typical result. It's a happy result for these people who, when I controlled the pain that was in their arms or in their knees, their gray hair turned black. Because it's a global
Interesting
thing.
you said that. Because we always saw where presidents, won't call any president, they go into office with black hair, and then after a few months, they get gray hair.
The president is on the clock 24/7.
Yes.
He's woken up every half hour to make a life-changing decision for somebody else. That's very, very stressful if you're doing it right. And but that's an example of how stress will age you. And the president is so stressed out, he's in a constant state of inflammation. And that is why when you see people, when they retire, suddenly the wrinkles melt out of their faces, right? Enough sleep. You look at the top models, Claudia Schiffer, for example. She says she looks fabulous because she sleeps 12 hours a day. She's doing everything.
Wow, I need to do that.
Really no.
My facelift.
And organic food. And we hear this all the time when people go back, immigrants to the United States go back to the country of origin, and they say, my pain got better. And it's because I was eating natural food. They've decreased inflammation that way. Or they're sleeping more when they're on vacation. Or they're walking more or something. Anything to decrease inflammation will decrease your pain. PTSD and stress and anxiety, they're all related to inflammation.
Wow.
The neurologists, the brain doctors are now studying Parkinson's disease and Alzheimer's disease, inflammation. So if you eat more fresh fruits and yogurt, you'll have less inflammation. If you eat more fried food and pepperoni pizza and diet soda, your Parkinson's disease will accelerate.
Okay, got it.
Well, there's some patients whose gray hair turned black. I've had maybe 3 or 4 out of hundreds who I learned that diet is important. Here in the United States, we're in the concrete jungle. In New York, we're in the concrete jungle. You can't find fresh fruit to eat sometimes. It's decent quality. You go to the store and you buy a piece of balsa wood that looks like a peach and is not good tasting.
Yeah.
I've got patients who I give vitamin C and vitamin D to, and tell them to have some fish oil, eat some seaweed, eat some seafood, and then come back in 2 months. I have found that I can't just jump in with the injections. The body can't heal without good starting material.
Yeah. Wow.
So I tell them, come back in 2 months when you've loaded up in vitamin C and vitamin D, and we'll do the injections. And some of them come back and say, I have no more pain. My shoulder pain is gone since I changed my life, since I changed my diet.
No more pain. Thank you so very much, Dr. Earle Smith.
There's so much more to say.
I know, but we're out of time. We're out of time completely. So thank you so much. Thank you, Dr. Earle. Thank you, Dr. Dawson. Thank you to the studio engineers and our producers, Power 106. That's all we have time for. Rehabilitation Institute, located at Suite 2A to Sealigany Post Mall. That's all we have time for. Thank you. Goodbye. Blessings.
Blessings.
Thank you. You too.